your microphones are muted for the duration of the presentations. I think Chanel will also assist me with that. And then we will have time for questions after all the presentations are finished. However, you are welcome to post your questions in the chat box, and Dr. Kuhn will assist me to navigate through them at the end of the session. So I think everyone here today will agree that we are living in a time where nutrition advice and food choices are increasingly influenced by what we see online. These spaces create opportunities to share nutrition and promote healthier food choices, but they also present many challenges around misinformation and accessibility. So the three speakers joining us today will guide us through these issues, sharing some thoughts on what is known about the digital food environment. Our speakers for today is Dr. Kuhn, Mrs. Kreft, and Mrs. Van Tonder. So whilst I'm going to stop sharing my screen, and I'm going to ask Dr. Kuhn to please share her slides with us, and I will then do a short introduction. Thank you.
Thank you and good afternoon, everyone. Thank you, Dr. Smith. Just give me a second and I'll share my screen. Can I ask, can you see my screen?
I can see your screen clearly. You can just put it on presenter mode.
Thank you.
Perfect. Right, so Dr. Kuhn is a registered dietitian and senior lecturer in the Division of Human Nutrition. The research areas and interests fall within the public health nutrition domain with a focus on food and nutrition labeling, population level strategies to reduce non-communicable diseases, and the digital food environment. We look forward to your presentation, Dr. Kuhn.
Thank you, Dr. Smith. Good afternoon, everyone, and thank you for joining us for this webinar. I would just like to provide you with a brief introduction to the digital food environment before Megan and Nicole share their research findings with you. So first of all, what are digital food environments? Well, it's the online settings through which services and information flow that influence people's food and nutrition choices and behavior. It encompasses a range of platforms, as we know, including social media, food and delivery applications, online retailers and websites, as well as other applications. Now, a wide range of activities happen on these digital platforms, including food marketing and advertising, such as the promotion of food products through social media, online videos, influencers, as well as targeted ads, food retail and delivery, including online grocery shopping platforms, for example, supermarket apps and websites, as well as restaurants and fast food delivery services via apps such as Uber Eats and Miss Delivery. Now, other activities include information sharing and education, and this can include nutrition advice via blogs or YouTube, TikTok, or health websites, online recipe platforms, as well as cooking tutorials, and even apps and tools for calorie tracking or diet planning and health monitoring. Apologies. Then social interaction and influence. So this is things like food trends spreading through social media challenges, influencer endorsements shaping food choices, and online communities discussing things like diet, body image, or healthy eating. Also, data collection and personalization, with algorithms tracking user behavior to target food-related ads, as well as personalized recommendations that you get for products, meals, or diets. And then lastly, policy and advocacy, which can include campaigns for healthier food systems run through things like online petitions, educational posts, as well as awareness campaigns. Now, in South Africa, where internet access and smartphone usage are increasing, the digital food environment has become a rapidly evolving space that affects everyday food decisions. Now, for the purpose of today's webinar, we will focus on two aspects of the digital food environment. This includes online food retail, as well as social media and the impact of social media on food choices. Now, since the COVID-19 pandemic, South Africa has seen a major rise in online grocery shopping. If we think of services like Checker 6060 or Pick n Pay ASAP or Woolies Dash, they've all made it possible to order groceries from the comfort of your home. Now, this convenience has changed shopping habits, especially in urban middle-income households. However, challenges still remain, such as limited access in rural areas, delivery costs, and digital exclusion for lower-income groups. Now, in South Africa, online grocery or the grocery market in South Africa is expected to reach 80 million rand by 2026 and 130 million by 2029. And South African e-commerce users are forecast to grow from 11.7 million in 2025 to approximately 21 million in 2029. Now, beyond shopping platforms, social media plays a powerful role in shaping food choices. If we think of platforms like Instagram, TikTok, and Facebook, food is often one of the most popular categories of content. Now, influencers and targeted advertisements often promote both healthy and unhealthy food. Now, in early 2025, South Africa had 26.7 million active social media users, and this represents approximately 41.5% of the population, with usage growing steadily. Now, about 60% of adults aged 18 and above are active social media users, and the gender split is nearly even. Now, South Africa uses social media for information and connection, with users engaging with an average of just over 8 social media platforms at any given time. Now, while the digital food environment presents risk, it also opens up important opportunities. Now, first of all, wider access to nutrition information. Online retailers can integrate front-of-pack labeling, ingredient lists, nutrition information tables, health endorsement logos, or things like search functions and healthier swap suggestions directly into shopping platforms. Now, this has the potential to nudge the consumer towards better choices at the point of purchase. Secondly, digital platforms can be used positively for public health campaigns. The same tools that we know drive fast food sales can also be used for nutrition education and healthy behavior change. Thirdly, the data generated from online shopping can provide valuable insights into consumer behavior. This creates opportunities not only for policymakers but also researchers to understand consumption patterns and to design targeted interventions. And lastly, digital tools could also support food security initiatives. For example, linking a smallholder farmer to online platforms, reducing the distance between farm and table, and promoting local food systems. These opportunities, however, rely heavily on responsible platform design and strong partnerships between industry, government, and researchers. So if designed responsibly, the digital food environment can be a powerful ally for healthier diets. Now, of course, the challenges are equally significant. The first is the digital divide. As we know, many South Africans still lack affordable internet or smartphone access, and online grocery delivery is heavily concentrated in urban centers, excluding rural communities as well as lower-income households. Secondly, the digital food environment is dominated by the aggressive marketing of unhealthy, ultra-processed foods. Fast food chains and ultra-processed snack brands have huge advertising budgets, allowing them to flood social media and shopping platforms with promotions that's often targeted to younger consumers. Thirdly, we must consider the spread of misinformation, as Dr. Smith mentioned, on social media. Nutrition influencers, often without any formal training, share conflicting or misleading advice that can cause or that can confuse the public. The viral nature of these platforms means misinformation often spreads much faster than evidence-based content. And finally, a key issue in the South African environment is the lack of robust regulations governing the digital food environment. While there are some regulations around the advertising to children in traditional media, the digital platforms operate in a grey area. So there's currently no strong policies in place to, first of all, regulate online food marketing, to mandate the display of nutrition information on e-commerce sites, or to restrict unhealthy food promotion on social media. And this leaves us as consumers vulnerable to both unhealthy marketing as well as misleading claims. Now, without stronger regulatory frameworks, the risk of misinformation, digital exclusion, as well as unhealthy consumption patterns will continue to undermine the potential benefits of the digital food system. Now, why does this matter in the South African context? Well, following the pattern seen globally, the death rate attributed to non-communicable diseases in South Africa has increased substantially, and we know is now the leading cause of mortality in the country. Now, according to the WHO, the South African population has a 24% probability of NCD-related mortality between 30 and 70 years of age. Now, with rising rates of obesity, type 2 diabetes, and hypertension, poor diets that's high in sugar, high in salt, as well as ultra-processed foods are a major contributor to these conditions. Now, the digital food environment has become a driver of these unhealthy patterns, and social media promotes fast food trends and fad diets. Online shopping platforms often push processed foods with discounts and limited time offers. And because digital platforms are so pervasive, we know that these influences are often invisible and constant, shaping habits over time. This is why clamping down on harmful practices in the digital food environment is urgent, and this can be done by introducing stronger regulations, by curbing misinformation, and ensuring transparent, accessible nutrition information online. And through this, we can empower consumers to make healthier, more informed choices. To conclude, the digital food environment is reshaping how South Africans buy, see, and think about food. It offers exciting opportunities for innovation as well as education, but it also presents risks in the form of unhealthy marketing, misinformation, and unequal access. Now, currently in South Africa, there's a paucity of data on the digital food environment, particularly regarding online food retail, the influence that social media has on consumer choices, as well as the dynamics of the online retail space. Now, this gap highlights the need for research to establish baseline data, but also to track changes over time and to gain a better understanding of the South African consumer and how they interact with these platforms. Only then can we meaningfully shape the digital food environment in ways that empower consumers to make healthier, more informed choices. Megan will now share research with you on the impact of social media on food choices. Thank you very much.
Thank you, Dr. Kuhn, for sketching a very clear picture of the digital landscape and providing a good introduction for our next speakers. Good afternoon, Megan. I'm just going to do a short introduction. Megan is a clinical dietitian who recently graduated with a master's in therapeutic nutrition from Stellenbosch University. Her research interests include the digital food environment with focus on the use of social media as a source of nutrition information and the impact it has on users' food choices. Her previous publication, titled The Use of Social Media as a Source of Nutrition Information, sparked the interest in her master's thesis, which she will be presenting to us today, titled The Impact of Social Media on Food Choices in Young Adults. Over to you.
Thank you, Dr. Smith and Dr. Kuhn, for having us today. I'm just going to make sure that my screen is sharing. Can you see my screen?
I can see your screen perfectly.
Great. There we go. All right. So I'm going to be sharing some results from our master's research. So it was a self-reported impact of social media on food choices in young adults at a tertiary institution in Western Cape, South Africa. So social media is a source of nutrition information amongst young adults. That is something that we, and then 9% was high influence. So I think it's always important to look at these levels as well when we're interpreting the data, and not just take the 8 to 9% for what it is, but it's a very high percentage. So again, it just shows how important it is that we are looking at how we can create a better and safer online environment. So platform usage, so the highest daily engagement was Instagram, YouTube, and TikTok, with the least engaged platforms being Twitter, LinkedIn, and Facebook. So this is likely due to the characteristics of Instagram. So with Instagram being the most popular, you're able to engage with images, videos, links, shoppable links, and also a chat function. So you're actually able to engage and interact with the person that's behind that profile. And users have described these interactions as fun, entertaining, and interactive. So again, when we are looking at effective health campaigns, it's important that we choose a platform that will actually be benefiting the outcome of that campaign. So if we are looking at a health campaign, we maybe shouldn't be using Facebook, but we should probably be using something like Instagram, which is quite useful. And then when we come to sources of information, so friends and family were identified as the main source, and research has shown how peer support has a big impact on health behaviors. And there's also a lot of messaging amongst friends and family on social media. Then healthcare professionals were also up on the list, which is great. So it shows that we are a source, but it's just to be reminded here that healthcare professionals have to be abiding the marketing codes and ethical standards that are set out in regards to sharing and actually marketing products. So the specific table is for purchasing products. And we need to make sure that we are transparent and that we have integrity. And this is also outlined or guided by the HPCSA guidelines for good practice in healthcare professionals. And then as well as ADSA guidelines. I will mention that the ADSA guidelines are quite old, so there's probably that probably should be reviewed and updated to better guide in this perspective. And then interestingly, feed content also had a high influence on purchasing behaviors. So research has shown that social media or social media food marketing specifically can be masked by regular content. So often paid marketing posts or gifted content is not disclosed on social media. And also the general population who share product information might not be doing so for marketing purposes or even being paid to do so, but it can still be influential. So just shows the high exposure to nutrition-related information that can just appear on your feed. Then when it comes to following dietary advice or recommendations, again, friends and family were high on this list. And then registered dietitians as well, which is great. So this is really promising because it shows that we do, as dietitians, have an potential to be influencing on social media. And like we've mentioned before, there are some barriers to dietitians actually making use of social media. And this has also been investigated within South Africa. And some of these barriers included things like time available to post, familiarity with platforms, technical knowledge and rate of engagement, and maintaining confidentiality online. Another Australian study, for example, has also emphasized that dietitians need to be upskilled. And this is something that I definitely agree with, is that there needs to be better guidance and maybe better training in terms of how dietitians can make better use of social media and feel more confident to do so. And then this will also help facilitate the growth and impact of healthcare professionals or registered dietitians profiles on social media. And then contrary to previous research or what we might have expected, you'll see that the influencer actually was lower reported, which is interesting. So it shows that maybe people don't really actually want to follow what they're suggesting. We'll see later on that there was some contrary result to this in terms of the recall, which we'll address a bit later on in the slides. And then types of nutrition information, the frequency of use of different types of nutrition information. So 91% reported using recipes, 38% reported using diets, 47 supplements, and then 70% food products. So within the recipe group, we'll see this happen 2 to 3 times per month on the higher scale. And it was mostly things like 30-minute meals, high protein meals, and recipes with minimal ingredients. So a bit more of a convenience option there. For supplements, it was mainly multivitamins that were reported. For diets, it was mainly weight loss or sports performance. And again, their usage amongst those two groups were quite low, which is also maybe different to what we had expected. And then food products was also mainly convenience snacks. So it seems like, social media in this day and age is definitely used in a convenience option. So keeping things simple might also be a good way to go in terms of sharing information. Then if we look at the analytical analysis of these results, there were two areas that had significance. So recipes, so females used recipes more so than males, and then supplements were actually used more by females. So this is also interesting in terms of maybe where we are, what type of information we are providing to what target audience. So if we are looking at recipes, then we might perhaps meet or target a female audience more so than a male audience, which is something just to keep in mind. And then when it comes to the self-reported influence of these different categories, recipes again came up the highest with 90%, our diets with 60%, our supplements 51%, and then food products were 85%. So this information can really guide to the types of information that dietitians can share online, so where we should actually be spending time in creating content. It's also important that we remain relatable and that we try and use this guidance in a smart way. So for example, if we are creating recipes, we could incorporate advice regarding food products. So for example, if you're using yogurt, you might want to say, let's use low-fat yogurt in this instance instead of full cream yogurt. And that could be a way to help incorporate evidence-based information and knowledge into the recipe as well as using a food product. So it's just about how we can share this in a way that is relatable, whilst also sharing evidence-based information. And then what was interesting for us is we actually asked participants to recall specific purchases or times that they've implemented the use of this nutrition information for what they've seen online. So for food products, so 44% reported purchasing a food product because they saw it on social media. The frequency of this was roughly monthly, the most. The platform most recorded was Instagram, and then the source was influencers. And for reference, we've just put a few of the examples on here. So for example, Checkers, Oh My Goodness bars, Woolies ready-made meals, kefir or herbal teas, parasitic cleansers, protein bars, You Cook. When it comes to recipes, 82% reported using recipes from social media, with the highest frequency also being monthly. The platforms Instagram and TikTok, and then sources also influencers, random people on their feed. And then here the specific recipes were things like TikTok feta pasta, overnight oats, meal prep, quick dinners. So for these two being clearly the most used information, I think it's quite interesting that the highest recall was influencers, random people. So it could be that, influencers maybe have more impact compared to a dietitian. So if you're thinking about actually recalling the profile or the original source, they maybe have better brand recognition. They maybe had better impact. So you might remember them more so. That's something we'd have to investigate further. And then also that these examples that participants had written or responded, it's not necessarily inherently unhealthy or harmful, but there is quite a range. So for example, having someone buy parasitic cleanse is something that could be harmful, but the others might not. So there is a need to really be able to somehow screen this, or to just highlight credible sources, that we don't have these potentially harmful information making its way to people's feeds. And then supplements and diets were not reported being used very often. So 73% and 85% did not use or purchase supplements or diets from social media. And then examples here as well. So just collagen powder, vitamins, weight loss pills, protein powder, probiotics, and then diets with things like Banting, keto, intermittent fasting, high calories, vegetarian, vegan. So again, it's not necessarily inherently harmful, but there is still quite a range. So it's important that we are ensuring that there is some kind of monitoring on here. Okay, so then limitations of our study. So it is not generalizable. So due to the nature of the data collection and it being self-reported data, it's not generalizable. It's also a population that is mainly females and young registered students, so that also needs to be taken into consideration. The questionnaire was conducted online and you can't get additional information for clarification or be able to describe questions better. And then participants from the pilot were also not specifically excluded. In conclusion, social media had an impact or self-reported impact on food choices in eligible respondents. Recommendations from friends and family had the most impact on food choices, although influencers were the most recalled source. Instagram was the most used platform and had the highest recall. And then recipes and food products were the most used types of nutrition information. So a team approach should really be adopted to develop guidelines and solutions to combat misinformation, including ways to help support healthcare professionals in sharing nutrition and health information online and marketing legislation. So this team should include dietitians, policymakers, public health professionals, marketing specialists, social media influencers, as well as social media platforms. And then further research should aim to include probability-based representative cross-sectional and cohort samples to explore the complex dynamics of social media and its impact on food choices. And the aim of future studies to have intervention studies to evaluate the effectiveness of different health communication strategies on social media platforms to also improve food choices and health outcomes. Thank you very much. That is all from me today.
Thank you so much, Megan, for that extremely interesting presentation. I think I just realized the power and importance of these platforms going forward. If you look at the percentage of people that actually access and use them. But yes, let's keep our questions and discussions for later. And I'm going to ask Mrs. Van Tonder to please share her slides, and then I will do a short introduction.
Good afternoon. Just checking if you can see.
I can see your slides clearly. You can perhaps just switch on your camera when I introduce you. Right, so Nicole van Tonder is a registered dietitian and online nutrition coach with Best 10, a Discovery Vitality partner. Her master research focused on how nutrition information is displayed and made accessible on online grocery platforms in South Africa. She's passionate about the intersection of nutrition and technology and is now gearing up for a PhD to build on this work. She believes that digital tools have the power to make nutrition more approachable, transparent, and impactful for everyone. Thank you, Nicole. You may start.
Thank you so much. Awesome. Okay, good afternoon, everyone. Yes, so today I will be presenting my thesis titled Online Grocery Shopping and Nutritional Labeling and Analysis of Digital Platforms. So this research was conducted as part of my degree in human nutrition at Stellenbosch under the supervision of Dr. Nalin Kuhn, and the biostatistician was Prof. Tanya Esterhuizen. So online grocery shopping has expanded rapidly, especially since COVID-19, offering convenience and wider product access. Yet this trend grows. As it grows, ensuring consumers can still make healthy choices is critical, particularly in South Africa, where non-communicable diseases like obesity and diabetes are rising. Nutrition labels are key to inform decisions, but under current R146 regulations, online retailers are not required to provide them. This leaves many shoppers without essential information. While some countries mandate online nutrition labeling, South Africa does not, creating a significant gap. So this study investigates how accessible nutrition information is on South African online grocery platforms and whether it equips consumers to make healthier choices. So the central research question that guided the study was how available and accessible was nutrition-related information for food and beverage products on South African online grocery platforms. And from this, the main aim was defined, and it is to investigate both the availability and accessibility of nutrition information on food and non-alcoholic beverages across South African online grocery websites and mobile applications. So to achieve this, I focused on three main objectives. The first one was to determine whether this information is actually provided, so its availability. The second was to assess whether easy consumers to find and use, so its accessibility. And the third was to determine whether these platforms allow consumers to search for products that meet specific nutrition-related criteria, such as low sugar or high fiber, etc. In addition to these, two secondary objectives were set, and this was to compare the availability of nutrition information between websites and its corresponding app, and similarly to compare the accessibility between the two formats. So this was a cross-sectional descriptive study with an analytical component. The study was conducted across 21 South African online grocery stores that sold food and non-alcoholic beverages through either a website, an app, or both. These included consumer goods, wholesalers, and pharmacies. To identify these platforms, I conducted a census during March and April 2024 using multiple approaches. Excluded stores were those offering only promotional content, limiting their delivery areas, or functioning mainly as food delivery services. Data collection was conducted by me, the researcher, using an observational checklist. The checklist was based on the South African Food Exchange List and was refined after piloting and expert review. Food products were grouped into categories such as starches, proteins, dairy, fruits, vegetables, fat, sugar, and luxury items. So for analysis, descriptive stats, means, and standard deviations were computed using Microsoft Excel. Accessibility was measured in terms of the number of clicks and scrolls required to access nutrition information. Fisher-Exact tests were applied to evaluate availability, and t-tests were used to compare accessibility between the websites and apps. A biostatistician supported the analysis process, and importantly, no direct involvement of retailers or consumers was required, and all the information accessed was publicly available. So to protect the privacy of the stores, names were coded and omitted with all the data securely stored. So all 21 online grocery platforms, it was 20 websites and nearly 11 apps, displayed some form of nutrition-related information. In most cases, this was provided in combination of text and images, with only a small fraction relying on images only. Sorry, I lost my place. Importantly, all platforms consistently displayed at least a product name or description, which is the most basic form of product identification. Although nutrition information was present, the depth of detail was limited. Fewer than 40% of food items on websites and fewer than 30% on apps displayed a full nutrition information table. Websites performed slightly better than apps when it came to displaying ingredient lists and serving sizes, but even here the coverage was relatively low at around 20 to 34%. Instructions for use were the least frequently provided at around 12% on both websites and apps. So in terms of accessibility, apps were more user-friendly. On average, it took just 1.4 clicks to access nutrition information, and on apps compared to 1.6 clicks on websites. While the difference may seem small, statistically it was highly significant, and from a consumer perspective, fewer clicks can mean a more seamless shopping experience. The average scrolls were the same on both platforms at 1.1. So when examining the search functionality, differences between websites and apps became more apparent. So on websites, the most common nutrition-related searches included terms like whole wheat, gluten-free, high protein, and sugar-free. And on apps, however, broader functionality was observed. Most apps allowed searches for terms such as high protein, plant protein, whole wheat, and low fiber. Some also supported terms like high energy. This suggests that apps may better facilitate consumer-driven, health-oriented searches. Finally, when comparing across categories, websites consistently provided more nutrition-related information than apps. They were significantly more likely to display ingredient lists, serving sizes, allergen, nutrition information tables, and nutrient content claims. The only category where no significant difference was observed was instructions for use, which were infrequently displayed across both platforms. Looking at the literature, online platforms could really improve access to nutrition information, especially for people with limited mobility or living in food deserts. In South Africa, many consumers say they value food labels, but their impact depends on literacy levels and trust in the information. Compared to other countries, we are behind. For example, in the US, 82% of foods online had nutrition information tables, while South Africa shows far fewer. The upcoming R337 regulation could change this by requiring more transparency online. Right now, the lack of consistent information poses a real risk to consumers' health and their ability to make informed decisions. And globally, systems like Nutri-Score in Europe prove that simple, clear labeling can push people toward healthier choices. In terms of accessibility, nutrition information on South African grocery websites and apps was generally easy to find, often just one scroll or 1 to 2 clicks. And this lines up with a US study that also found most nutrition information could be reached with a single click from the product page. But here's the catch. Other research suggests that if nutrition information is hidden behind extra clicks, people are less likely to use it. So while accessibility looks good on the surface, how it's presented, directly visible versus hidden, really matters for consumer use. So research shows that most people shop online much like they do in store, moving through virtual departments such as produce, dairy, or packaged foods. Filters can make a big difference here. They allow for personalized nutrition choices, something you can't really do in the physical store. So in South Africa, websites and apps show mixed results. They do well for protein-rich, plant-based, sugar-free, and whole wheat products, but there are clear gaps when it comes to searches for low energy, low protein, carb-free, high sugar foods. Internationally, filters like gluten-free, low-fat, or sugar-free are quite common, but even then, most stores don't let you sort by detailed nutrition information such as sodium content. So while some progress has been made, South African platforms could really strengthen their role in supporting health-conscious consumers by combining clearer labeling with smarter, more targeted search tools. So when comparing websites and apps, websites consistently provided more comprehensive nutrition information. Apps, on the other hand, were quicker and more user-friendly, but the trade-off was less detailed content. Websites also displayed nutrient content claims almost twice as often as apps, but interestingly, other claims and storage details were more evenly distributed. Research shows that using pictorial or color-coded displays can really help consumers, especially those with lower nutrition literacy, to make sense of the information. So overall, websites are stronger for detail, while apps excel at accessibility. And the challenge for the future is optimizing both, giving consumers the convenience of apps, but with the transparency and richness of information found on websites. So it is important to highlight the study's limitation to give context to the findings. So first, it was not assessed whether the nutrition information presented was legally compliant with the R146 or other food labeling regulations. The focus was on the availability and accessibility and not on regulatory accuracy. Second, the study did not differentiate between cases where information was not provided by the retailer and cases where it was not simply applicable to the product. For example, fresh produce that is exempt from labeling. Third, because nutrition information was gathered manually, there's a possibility of inconsistencies. Online platforms frequently update their product listings, so the data might already have changed after collection. Finally, the short-term time frame and limited product categories means the findings should be interpreted cautiously. They provide useful insights, but they don't necessarily capture the full spectrum of nutrition information across all categories or seasonal changes. So the study's strength lies in its scope. It covered all 21 online grocery stores available in South Africa, examining over 5,000 products across websites and apps. And went further than just availability. By comparing websites and apps, the study revealed key platform differences in how nutrition information is displayed and accessed. The inclusion of searchability testing with common terms like gluten-free or high protein gave practical sense of how easily shoppers can find relevant nutrition information. Altogether, the study not only maps the current landscape, but also makes an important public health contribution by highlighting the need for standardized, consistent, and easy searchable nutrition information. So for online grocery platform, the key recommendation is to standardize nutrition information across all products. Ingredient lists, allergen warnings, and serving sizes should be consistently displayed. Expanding front-of-pack labeling online can also help consumers make quick, informed health choices. Platforms should also adopt advanced search filters, making it easier for shoppers with specific dietary needs like low energy, low sugar, or high protein diets to find what they need. Improving navigation and offering educational resources like tutorials would further support healthier consumer choices. At the policy level, the Department of Health should step in to create clear, enforceable regulations for online food labeling. This would ensure that nutrition information is consistent, accurate, and accessible across platforms, similar to in-store standards. Finally, future research should be broader, covering all South African online stores and product categories. There's also value in comparing online labels with physical packaging to see where information is lost. Research into the user interface design, better search functionality, and educational tools could make nutrition information even more accessible and user-friendly. So overall, South African online grocery websites and apps show significant gaps in nutrition-related information, which limits consumers' ability to make health-conscious choices. Although all items were named clearly, critical details like nutrition information tables, ingredient lists, allergen warnings, and serving sizes were often missing or inconsistently displayed. This leaves shoppers without the full guidance they need. Front-of-pack labeling, which is widely recommended for quick, healthy decisions, was also underutilized, representing a missed opportunity for both websites and apps. Accessibility was relatively good, requiring minimal scrolling and clicking, but that does not compensate for the limited scope of available nutrition information. Comparing the two platforms, websites provided more detailed and reliable nutrition information, while apps offered easier and faster navigation. However, this inconsistency may confuse consumers, making it harder for them to make informed dietary decisions. So strengthening consistency of nutrition information and improving search functionality will be crucial for enabling healthier choices. If these improvements are made, online grocery platforms could play a much stronger role in supporting public health while also building consumer confidence in digital food shopping. Thank you so much.
Thank you very much to all three our speakers for their very informative and thought-provoking presentations. We are pretty much on time and we have a little bit of time for questions. So I would like to open up the floor for any questions to our presenters. I've checked in the chat box, but I couldn't see that anyone posted questions there. But yes, just let us give a round of applause for our presenters as well. Right, any questions to the audience? I'm just seeing lots of claps, but I'm not seeing any hands that's raised. Okay, Mrs. Chetty, you can go ahead. Thank you.
Thank you. I think firstly, I want to say what an interesting topic and presentations this afternoon. It was really valuable. I've got one question for each of the presenters. So I know that Dr. Kuhn had mentioned the challenge was really, misinformation and lack of reliable nutrient content on these sites in the digital food environment, and also a weak regulatory framework. I think my question was just, what would you think, or what do you advise, Dr. Kuhn, would be the best place, or who would be the best persons or people, or I don't know who, nutrition gurus, who would be monitoring or who would be able to assist and to improve? I just wanted to pick your brain on that one. If you don't mind. And then,
Yes,
I don't know, do I ask all the questions or do I just go one at a time?
I think let's answer the first one,
okay.
and then we can go on to the second one. Dr. Kuhn, will you respond?
Yes, of course. Thank you. And thank you so much for the question and the comments. I think in terms of the regulatory framework, we have the R146 labeling regulations that govern the labeling of physical packaging on food products. And then we also have the Consumer Protection Act that covers some of the labeling aspects. And then depending on the product, we have things like the Agricultural Product Standards Act. So there's a lot of different regulations that obviously impact on the labeling of food. Now, the problem is currently, even with our new proposed draft regulations, the R3337, is that nowhere in the legislation does it explicitly state that what needs to apply on physical packaging also has to apply online. So I think that is the first step, is that we must close the gaps in our current legislation to ensure that food retailers are required to include at least minimum information about food products online. Okay, and that it is the same, obviously, as on physical food packaging. Now, in saying that, we know that the current policing of even physical food packaging in South Africa is lacking due to a lack of resources. We do not have enough people to actually check food labels. Environmental health inspectors are responsible for that, but we know that currently the industry is actually more policing themselves than health inspectors are. But if we look at what happens in other countries, some countries do have specific regulations in place for the online environment. And there, as a consumer, you can either report a company or a retailer if the information is missing, or what we often see happens is that the retailers actually report or take on one another. But without proper legislation, first and foremost, I think obviously there's not much that we can do because we have no legal grounds to stand on. So that's probably the first, or the start, is that we need to physically include in our legislation that the legislation also translate to the online food environment. I hope that answers your question.
No, for sure.
It's a loaded question. There's lots more to say.
I hear you. But thanks for that. I think we should all just canvas for that online labeling requirements as well. Thanks, Doc. I think for Megan, I just wanted to check. Thanks, Megan. That was quite an exciting self-reported social media presentation. I might have missed it, but I just wanted to check with you. You mentioned that supplements were also, I think, one of the most, I think something like 47%, if I'm not mistaken. And I wanted to know what type of products? Sorry if I missed it, but I'm just interested in understanding what is the supplement products that you picked up. And then I also know that you had a very young 21-year-old mean age group, but I was interested in the ethnic diversity. Was that reported?
Thank you very much for your question. I don't believe we did the ethnic. We didn't check the ethnic background in the questionnaire. I think that's always something I've definitely learned in master's research, is the more you look back at your research and the more you are able to critically evaluate what you did, the more you realize maybe how much better you could have also made your questionnaire, which is something that I think we can all acknowledge and appreciate. So no, that was not done. Then the second part of the questions for our supplements, so it was vitamins, multivitamins was the most reported category. So yeah, quite interesting, I guess. Something that's also quite interesting. That was the most reported.
Okay, thanks so much. So I'm from the food composition space, hence me asking this, because I think the research is valuable, because this also feeds into what we need to have in our database, because what are people looking at? So thanks for that, Megan. Thanks, Nicole. I think yours was, I just realized, wow, 21 online shopping sites in South Africa. I didn't realize there were so many, but that was quite interesting. I think for me, the first question I wanted to check with you was, I noticed you had different categories, and then there was like luxury items and sugars. I was like, what is a luxury item? I just wanted to understand that a bit more. Thanks so much.
Thank you for the question. Yes, so it was based on the food exchange list. So it's basically like those convenience meals that you can buy at Woolies or Checkers. Those ready-made meals, basically. That's what it was made of.
Oh, okay. Thank you. I don't know if I want to pick your brain. I know you have 21 sites. Which one ranked the top for you? Are you able to disclose or not?
I think I can disclose it, Dr. Cook. I think I can. Yeah, no, Willie's won everything. It was very nice. Yeah,
for sure. Thanks. I just wanted to check with you. I know you looked at all this accessibility and all of those things, but did you at any point sort of doubt or think about how true are these nutrition values label? Is it like legit, or did you not worry about that? Were you just wanting to look at, I know your focus was accessibility, etc. But at any point, did you question the data source of the nutrients? Thank you. I'm done with my questions.
Thank you so much. Yes, I think going through so many stores and looking at all the numbers all the time, it does mush in your brain. But I think definitely there is, that data source uncertainty. I think nutrition labels are like often copied from manufacturers, and the accuracy can be very questioning. From what I have seen outside of research, comparing things on nutrition apps like MyFitnessPal, comparing it to the online thing, it's not the same. Not saying MyFitnessPal is always accurate, but looking at different stores, it's definitely something that needs to be reevaluated and checked.
Thank you, everyone. I see we are actually exactly on the hour, but I noted that Prof. Du Plessis has a hand. So perhaps a short question and a short response before we end the session.
Thanks. I'm going to be quick. It's actually just maybe a suggestion or something to share with you. And well done, Aline and Megan and Nicole. Very interesting presentations. So this digital space is so hard, as you say, to regulate. But maybe just something interesting that came up in the commercial milk formula space because of the new regulation that the WHO has passed on digital marketing of commercial milk formula. AI can actually now detect the social media and online advertising and so forth, and that could in future possibly be then an easier way or maybe just a complementary way of not necessarily, policing is not the nicest word to use, but maybe to regulate and then also to immediately and automatically report these things so that it's not necessarily a person that needs to go and do that, But yeah, I thought that was just something that is noteworthy to share. Thank you.
Thank you, Prof. Du Plessis, for sharing that information with us as well. I think we've come to the end of our presentation. Just to note, for those who still have questions, you are welcome to contact Chanel Windvogel for the contact details of our presenters. They had it in their slides, but in case you've missed it. And I think just in closing to say that besides an urgent need for a regulatory framework to control this new digital environment and almost our new normal, there's also, I think the presentations emphasize that we need collaboration between different stakeholders to ensure that our digital world supports consumers and that it doesn't undermine public health. So with that, I'm going to close today's session. And once again, thank you for everyone who joined and for the presenters. It was really interesting. Thank you.
Thank you very much. Bye-bye.
Thank you. Bye.